Cultural competency is a hot topic and honestly something that we should have been focused on a really long time ago. We're a nation of many, and we come with many different backgrounds. We come with many different cultural practices. And just being able to interact with a patient from the door sometimes can be difficult if you don't have an awareness of where they're coming from and what their background is.
Cultural competency can be a difficult concept to grasp. To me, it's having a genuine and earnest respect for each patient and their culture and what they bring to the table.
We in healthcare, we as dermatologists, really doing things that can complement the patient's personal choices, their religious choices, cultural choices, really taking all of that into mind when we actually prescribe, treat, diagnose, and follow up with patients.
There is no one-size-fits-all approach. It's recognizing the unique circumstances and context of that individual patient in front of you.
I think in the past in medicine, we had a tendency to take what I would describe as a cookie cutter approach. And now with the world of cultural competency, it just means being a little bit more thoughtful of someone's background and someone's culture before you come up with a plan.
We often prescribe medications for our patients. We do that every single day. But sometimes we don't understand that there are some barriers that patients face. Are they able to pick up the medication? Is the medication even covered by their health insurance? Having an awareness of your patient's experiences, that they have other things going on in their life, and being able to meet them where they are.
I have many women of African descent who have scalp or hair problems. And they come to me and they say, Dr. Taylor, the last doctor that I saw told me I needed to use this shampoo and shampoo every day. I can't do that. Well, that's a doctor who's not culturally competent. I know most women of African descent will shampoo once every 2 weeks, maybe once a week. I know that there's some shampoos that are too harsh and will cause breakage of the hair. That's a fundamental essence of being culturally competent.
Patients come in all the time, just really upset that a doctor that they sought out for help with a particular condition gave them instructions that really are just not going to work with their lifestyle or their hairstyle. If you're dealing with a medical condition that requires you to frequently wash your hair, you need to understand that different hair textures have different needs, and you have to help the patient to find a good middle ground.
It's important to not only learn from your patients by asking them questions that pertain to their either hair care practices or other cultural practices, but it's also important to do your own research and learn about the cultural practices and styles or other things that may impact their care.
Even just understanding different differences anatomically, different textural differences, it can really change how we treat patients. One patient told me that the last dermatologist they saw was actually remarking that they didn't seem to be using the moisturizer frequently enough. And the patient actually got upset and then decided to see me. And they told me, hey, I'm using the moisturizer, but my skin is still dry. And then I told them, well, actually, black skin and skin color patients, they actually have increased transepidermal water loss, and there's genetically encoded features that result in that. And then the patient was like, wow, like that's actually a different presentation of my disease. So it's well known, that African Americans have more of that transepidermal water loss, that early moisturizing really is important, but even if you moisturize, that's a concern. So things like that, I think just impact care, it impacts attitudes, it impacts respect also between a provider and a patient.
So partner with the patient, lead with cultural humility, and actually give patients a choice in their own healthcare.
It's important to make these connections with your patients so that way they understand that they're being heard and also cared for.
When you demonstrate a willingness to be understanding about a person, all it does is enhances the relationship and the experience for everybody involved. So it really behooves all of us to do the work that we can to try to be as culturally sensitive as possible.